This facility is as impressive as it is important. The Centre will provide the platform for training and service programs to be delivered globally with increased innovation and collaboration with the Australian Hearing Hub. The Centre will benefit more than 10,000 Australians each year, so it is my great honour to declare the Centre for Innovation open. Congratulations to everyone.
I'm Greg Leigh, and I'm Director of NextSense Institute, which is the research and professional education arm of NextSense. Conjointly, I'm a Professor in the School of Education at Macquarie University. NextSense Central, where I'm sitting today, is located on the campus of Macquarie University here in Sydney, Australia. Being here on the campus puts us right in the centre of a unique ecosystem of research and professional education and service provision as it relates to people who are deaf or hard of hearing in particular. As one of the members of the Australian Hearing Hub here at Macquarie, we get to collaborate with our colleagues from Cochlear Limited, from the National Acoustics Laboratory, from Hearing Australia, the Shepherd Centre and other service delivery agencies. And importantly, all of these organisations have a common purpose when it comes to hearing loss or services for people who are deaf or hard of hearing. This really is unique internationally, but it fits the service delivery model of NextSense, which is, by its DNA, inherently collaborative. NextSense's mission is to enhance the lives of children and adults who have vision or hearing loss by creating specified solutions for them through technology and other interventions. The organisation's been in operation since 1860 and has gone by various names over that period of time, but consistently has been providing educational and other support services to children and now adults who are deaf or hard of hearing, blind or have low vision. Most recently, its name change came from being the Royal Institute for Deaf and Blind Children, becoming NextSense in 2021. But the mission has stayed consistent: to enhance the lives of children and adults who have hearing or vision loss by creating specific solutions for them through education, technology, therapy, and other interventions, and leveraging research and professional education to enhance the lives of those people indirectly by creating the professionals and the strategies for intervention for the future. Undoubtedly, one of the most important studies has been the longitudinal outcomes for children with hearing impairment study, or the Leigh study as it's known. The impact of this study, the impact of the fact that we now can say unequivocally that earlier access to intervention provides better outcomes for children who are deaf or hard of hearing, has really been quite enormous. It's impacted on the introduction of universal newborn hearing screening programs in this country and right around the world. In fact, I've just returned from Dubai, where that study is quoted and used as evidence for advocacy for the introduction of newborn hearing screening across the Middle East. Really, it's hard to overstate the impact of a study that so unequivocally demonstrates the fact that earlier engagement leads to better outcomes, particularly when that earlier engagement is linked with earlier engagement with technology such as the cochlear implant. Another area in our research that really goes into the research and development area has been the development of something called UEB Online. UEB, Unified English Braille, is the standard for Braille users in the English-speaking world. And my colleague here, Dr. Frances Gentle, developed the world's first program to teach people to use Braille online. That sounds like an easy ask, but the system that she developed has two phases. One that makes it possible for sighted learners, parents, teachers, and others that are going to need to learn how to use Braille to use with their children or students. But importantly, another platform that allows blind or low vision users to learn how to use Braille online, independently, to a standard that makes them able to access Braille themselves.
The interesting thing about Braille is we use the same part of our brain, the back of the brain, for both print and Braille. So the mechanics of Braille, in terms of the way our brains work, is very similar. So Braille opens doors, it opens doors to employment, and the research in Australia and internationally shows that if you have Braille skills, you are much more employable than someone who simply can listen.
This really has been a game changer. We now have over 32,000 people around the world who access UEB online as a basis for learning the Unified English Braille system. Truly hard to overstate the impact that research and development project has had. Another important area of research here at NextSense Institute has been our work investigating the use of telepractice with children in early intervention and in audiological environments. Telepractice quite simply means using remote access technology such as video conferencing and remote control of computer technology to allow our therapists and our audiologists and teachers to engage with children and families wherever they may be. This came into real importance during the period of the COVID epidemic, and we were able to advance the evidence to show that we can achieve equivalent outcomes, and indeed in some cases better outcomes, for children using telepractice to deliver early intervention. Indeed, family-centred early intervention, the theory being that the control of the environment is in the hands of the children's family, is in fact in some cases facilitated by the use of telepractice for these purposes. Our research in this area has been widely cited around the world, and together with studies from the National Centre for Hearing Assessment and Management in the United States, really forms the underpinning for practice in early intervention using telepractice around the world. Almost all of what we do here is collaborative in nature, and indeed the whole rationale for moving from our former site at North Rocks onto the campus here at Macquarie University has been to become part of a vital ecosystem of organisations that are engaged in enhancing the lives of people with hearing loss and vision impairment. Here we collaborate with, among others, Cochlear, the Macquarie University, National Acoustics Laboratory, Hearing Australia, other agencies such as the Shepherd Centre. And with that, we're able to harness support from a range of funding opportunities. Most recently, together with the university, we've entered into a partnership with Google to create what has been called the Australian Future Hearing Initiative. That involves all of the partners here at the Hearing Hub. Together with partners at the university, we've harnessed funding from the National Health and Medical Research Council. Again, in partnership, we've harnessed funds from the Australian Research Council. But we're fortunate as a philanthropic organisation, or a philanthropically supported organisation, to have garnered support from a range of individual donors and supporters. Indeed, all of the support for the development of the UEB online research and development of the ultimate package came from individual philanthropists who were able to support that research and the development of the product right through to its fruition. NextSense really is known for fostering a collaborative, purpose-driven culture where the professionals who work here are united by that common purpose of wanting to seek better outcomes for children and adults who have vision or hearing loss. Core to that is collaboration. It's part of the DNA of the organisation that we collaborate internally and externally. Internally, that means collaboration between a wide range of professionals: early educators, teachers, early intervention professionals, speech pathologists, occupational therapists, audiologists, psychologists are just some of the professions that unite for the common purpose that is the NextSense mission. That is evident every day. As part of moving here to the Macquarie University campus and this new purpose-built Centre for Innovation, we've seen that collaboration only increase. It's wonderful to see our professionals across the board interacting around what is virtually a large water cooler, where people are intersecting on a day-to-day basis. And really are driving innovation through their interactions. It really is a wonderful place to work.